Good afternoon. Allegheny County Executive here, giving our every other week update. It's going to be a little change today. Dr. Bogan is out of town with family, and nobody deserves a vacation and being with family more than Dr. Bogan. And we're delighted that today our chief epidemiologist, Dr. Luann Brink, is going to give the report. You haven't seen Dr. Brink much, but I will tell you that the work that she has done over these last couple of years, along with the team here at the health department, have really put their efforts in and kept us safe. So we see, and Dr. Brink will give the report, but we see that the numbers are going up, the case numbers are going up, but still the vaccine, we say it every week, every other week, but it really is about the protection of the vaccine. So I really do appreciate all of you who've been going out, and now with the 5 to 11-year-olds who are eligible, the number of children that are starting to get vaccinated, and we see that number going up as well. So let me turn it over to Dr. Brink to give the report. Dr. Brink.
Thank you, County Executive. So good afternoon and welcome back to our regular COVID-19 briefing. My name is Luann Brink. I'm the Chief Epidemiologist with the Allegheny County Health Department. For those of you expecting Dr. Deborah Bogan, the Health Department Director, she's out of town today and unavailable, but she sends her warmest wishes to everyone for a safe and happy Thanksgiving. As we typically do, we'll start with the numbers, which unfortunately continue to be higher than we'd hoped for. For a couple months, new daily case totals were steadily in the 350 to 400 range. However, over the past 2 weeks, cases have risen sharply to about 600 to 650 a day. Today, we announced nearly 900 cases. A week ago, Allegheny County received updated and joined vaccination and case data. We also have information on reinfections, which represent about 1% of all of our cases. Because the data came in so different from the original format, we have not yet been able to update our dashboard, and it will remain static for about another week. So in October, there were 177 deaths. This was our third highest monthly number during the pandemic, only exceeded by December 2020 and January 2021. In November of this year, there have been 67 reported to date. Sadly, with winter and the holidays approaching, the disappointing data are not expected to improve soon. This is the time of year when people head inside and gather with others, and that, as we know, is the exact type of environment that fosters the spread of this virus. So what can we do to protect ourselves, our loved ones, and our community? Let's start with vaccinations. Here's what we know. Vaccines work. Certainly, there will be breakthrough cases, and we continue to work on a comprehensive analysis of such cases. These findings will be available soon. In October and November of 2021, there were about 7,700 COVID cases among vaccinated. This represented about 38% of our roughly 20,000 cases during this time frame. In Allegheny County, there are nearly 740,000 people with at least one vaccine, but there still remain others who have yet to be vaccinated for COVID or who are not yet eligible for vaccination. Even so, a majority of the population is vaccinated, and vaccinated people continue to represent a minority of the cases. In fact, a vaccinated person is about half as likely to get COVID as an unvaccinated person. We also know that the vaccine helps protect you from serious illness, hospitalization, and death. The vast majority of those who die from COVID are unvaccinated. As just one example, in the 50 to 69-year-old age group, less than 15% of the deaths were of individuals who were vaccinated. Nearly all those who are vaccinated and succumb to COVID are both elderly and have serious underlying health conditions. So I'll take this opportunity to remind everyone to get vaccinated or get your booster. Between 20,000 and 30,000 people have been getting their boosters every week this month and would like to see that number go even higher. As for children, about 20% of those aged 5 to 9 have received their first COVID vaccine in Allegheny County. This is a good start, but we can do better. That's why we are working with our healthcare partners throughout the county to ensure that every child in every municipality has access to a dose. Equity is and always will be a priority for ACHD, and we need to make sure all children are protected. Beyond vaccinations, I'll repeat the messages that Dr. Bogan gives us weekly, because the guidance she recommends is proven to be effective. Please follow CDC guidance on masking. Wearing a mask is an easy way to reduce the spread of COVID as well as other respiratory viruses like flu and RSD. Maintain physical distancing. Wash your hands regularly. If you're sick, stay home and get tested. And if you're attending or hosting a holiday party, please remember that outdoors is better than indoors, but this is Western Pennsylvania, so it's not always going to be possible. If you must be indoors, try to leave the windows and doors open to increase air circulation and keep guest totals low so that people can properly distance. Now, a quick housekeeping note. We'll not be issuing a 24-hour COVID update tomorrow as we observe Thanksgiving. Instead, we'll return on Friday with a 48-hour report. Thank you for your time. As we head into the holidays, please remember to be thankful and thoughtful. And if you are considering getting a vaccine or booster, please don't delay this decision further. We need to take the fuel off the fire that is this COVID outbreak. On behalf of Dr. Bogan and everyone at the Health Department, I wish you a happy Thanksgiving.
We'll begin with questions from the media. We have 3 today. The first comes from the Post-Gazette and the Pittsburgh Business Times. With the case counts the way they are and not having gone down, how concerned is the Health Department about a spike in cases in the coming weeks due to holiday gatherings?
You heard from Dr. Brink, giving the weekly report, coming up with the cases, and today almost hitting 900 cases. It is a concern. So a lot of the mitigating factors about gatherings, mask wearing, distancing, keeping the crowds maybe not as robust as in the past is certainly important. But I also couldn't emphasize enough that we know last winter what happened. It was a very, very difficult time. And I will say this will be a very difficult winter for the unvaccinated. It's going to be, again, the Delta variant is even more contagious than the Alpha variant from a year ago. And what we're seeing is, as Dr. Brink mentioned, October was the 3rd highest month of fatalities since this pandemic began almost 2 years ago. So for the unvaccinated, this is going to be a very, very difficult in a difficult time over these next couple of months, while the weather, puts everybody inside. So again, vaccine. We've got, 750,000 people fully vaccinated, almost another 110,000 or so partially vaccinated. We're over 860,000 people that have at least been partially vaccinated, and another almost 200,000 people that have gotten their booster shot. So we want to get as many people vaccinated. We want to get everybody vaccinated that can get the vaccine and is eligible for that. So that is really as these case counts go up, we want to make sure that the unvaccinated get their vaccines and get protected.
The next question comes from the Pittsburgh Business Times. Is the Delta variant still the predominant strain here in Allegheny County, and are there cases of other strains?
There aren't many cases of other strains. For the week of November 14th through 20th, HHS Region 3, which is us, Delaware, DC, Maryland, West Virginia, Virginia, 99.9% of all cases are Delta. There's an estimate for PA that has it at 99.4%. So there are very few cases other than the Delta variant.
Final question today comes from the Pittsburgh Post-Gazette. What are some precautions people can take if they plan on traveling or spending time with distant relatives?
Sure. So on mass transit, for sure, whether you're taking a plane or a bus, you need to wear that mask because you don't know who's around you, if they're vaccinated or unvaccinated. And if you can, at your gatherings, please find out if people are vaccinated and wear a mask if they're not. And finally, just get vaccinated. You might have time before Christmas to finish that up. And ventilate, as I mentioned, keep the guest list down and social distance. Overall, just please follow the CDC guidance, and hopefully our case counts will not increase as much as we may expect.
That was the final question. If there are any closing comments.
Well, thank you, Dr. Brink, and that was, again, good message for everybody as we enter the, got more cordial season, traveling season. We've seen reports where the airports are full again and people are traveling. They want to be with family. It's been a tough couple of years where some folks haven't seen their family members for over 2 years, but regardless if you're going to be at home or you're traveling, please take the precautions. Wear the masks in crowded places. Be mindful of being in crowded rooms and try to be in ventilated areas if you can, understanding while the weather is. But again, the importance is the vaccine, the vaccine, the vaccine. We really want to get as many people, and there's so many places you can get it right now, at our healthcare places, at the pharmacies, at the health departments, clinics, et cetera, and for the kids as well, for the 5 to 11-year-olds who are now eligible. We want to get those numbers, as Dr. Brink said. It's a good start, but we still have a long way to go getting those 5 to 11-year-olds vaccinated. So we wish everybody, on behalf of the health department and the administration, a happy Thanksgiving. Stay safe, and we'll be back to you in a couple of weeks with the next report. Thank you.
That concludes this week's COVID-19 briefing. The next scheduled briefing is Wednesday, December 8th at 4 p.m.